Welcome to the Super Healthy Human podcast with Dr. Rodger Murphree.
Hi, welcome. I'm Dr. Rodger Murphree, your fibrodoctor.com, author of Treating and Beating Fibromyalgia and Chronic Syndrome. Thank you for joining me tonight. I'm going to be sharing my Jumpstart protocols. These are protocols that I've used for the last 25 years, specializing in fibromyalgia. For a number of years, I owned a very large integrative medical practice on the campus of Brookwood Hospital here in Birmingham, Alabama, where there were 5 medical doctors who worked with me, chiropractors, acupuncturists. We had an IV clinic. We kind of did it all. So we did integrative medicine, where we used a very judicious use of prescription drugs, but mainly relied on a lot of natural therapies that I then improved on over the last 25 years. But in 2003, I sold that medical practice, and I've been practicing solo ever since. I had a very large telemedicine practice where I work with patients all over the world. I recently retired this year, and now my whole mission is just to continue to share this information with others who are looking for answers. And with fibromyalgia, unfortunately, so many are told that you just have to learn to live with it. And that's because most doctors really don't understand fibromyalgia. There's many that unfortunately don't even agree that fibromyalgia is real, even today. Those that do believe that fibromyalgia is a real thing, they really don't understand how to help you with it. And that goes for really for most natural or functional medicine practitioners, as well as conventional practitioners. So over the last 25 years, I've developed these things called the Jumpstart protocols. And what it's based on is to lay the foundation to help you to be able to quickly and dramatically see improvement in your pain, your fatigue, your poor sleep, your irritable bowel, all the things that we associated with fibromyalgia. Years ago, I came up with a way to quickly get some positive results that really laid the foundation for that individual then to be set up for further success as they went on their healing journey with their fibromyalgia challenge. The Jumpstart protocols are based on really 4 products. The 4 products are the Fibromyalgia Jumpstart Multivitamin, Optimal Daily Multivitamin, the Fibro formula, which has CoQ10, malic acid, high doses of magnesium, high doses of B vitamins, all the minerals, all the amino acids, which really the amino acids are the building blocks of our hormones. And unfortunately, those with fibromyalgia are notoriously low in these amino acids. I talked about that last week. But the Fibro formula is the cornerstone, and then based around that is 5-hydroxytryptophan, 5-HTP, which comes from the amino acid L-tryptophan. Digestive enzymes. 70% of people who have fibromyalgia have irritable bowel syndrome. So because of that, one of the things we have to do pretty quickly, really to turn things around, is to make sure that the individual with fibromyalgia is digesting their food, absorbing their food, and getting the benefit of the nutrients that are in their food. Not to mention, we want to make sure that the digestive system is working correctly so they don't have leaky gut syndrome, which is, I find that is a common problem in most of my patients with fibromyalgia. Yeast overgrowth, food allergies, bloating, gas, indigestion, stomach pain, reflux. These are all quickly remedied with the right protocols using the Jumpstart protocols. And the place to start for those, and we'll talk about some of that tonight, is a digestive enzyme. The last product that's in the Jumpstart package, the last of the 4, is adrenal cortex. Very important. And that's what we're really going to focus on tonight. We're going to talk about that tonight because if you can get your adrenal glands, your stress coping glands to come back online, then you can dramatically reduce your risk of fibro flares. You can dramatically reduce your inflammation, your pain, increase your mental and physical energy. You can have more stamina, more resiliency of stress. So that's what we're going to focus on tonight. And we'll share with you how you can self-test, how things you can do through your diet to really get your stress coping glands, the adrenal glands, working at their optimal levels. Over-the-counter supplements you can take, including the adrenal cortex, but there's others as well. So we'll talk a little bit about those tonight. I want to go ahead and get my screen up. Let's see. So we'll go ahead and do this. So we have some visuals, and I'm going to go ahead and share some information with you, and then I'll save time to make sure we have time for Q&A. Get this to behave. Okay, there we go. So last week we went through rather quickly, kind of an overview, but I really focused on deep restorative sleep because really that's the key. If you're not getting deep restorative sleep, everything is going to be affected. You're going to see that you have more pain. If you're not getting deep restorative sleep, you increase your inflammatory chemicals by 40%. If you're not getting deep restorative sleep, you're going to be tired. I mean, and if you hadn't got deep restorative sleep in years, you're going to be exhausted. If you're not getting deep restorative sleep on a consistent basis, you're going to have fibro fog. You're not going to think very clearly. Your metabolism goes down. So your ability to utilize calories effectively is compromised. You may start gaining weight or find that you can't lose weight. Might start retaining fluid, have some swelling in your ankles and feet. Mental clarity issues already mentioned, anxiety, depression, restless leg syndrome, increased risk of irritable bowel syndrome. These are all associated with poor sleep. And how you start to correct that, I went into detail about it last week, but it's really these four products: the Fibro formula, the 5-HTP, the adrenal cortex, which we're going to spend time on tonight, and the digestive enzyme. I talked last week, so I'm going to go through this really quick, and you can look on the replay. I think we're sending that out. I'm not sure if it's going out this week. It may be going out next week. If not, you can go on the Facebook, Your Fibro Doctor Facebook page, and you can see the replay from last week. Fibromyalgia affects primarily women. About 95% of those with fibromyalgia are women between the age of 20 and 50. It's estimated somewhere about 2%, 8% of the population has fibromyalgia, but it's worldwide. It's not here just in the United States. It's worldwide. Over the last 25 years, I've had patients in at least 15 different countries. So it's not here just in North America. It is throughout the world. And it's been around forever. It's been around for centuries, decades for sure. But in 1990, the American College of Rheumatology came up with a criteria to be able to diagnose fibromyalgia. Unfortunately, rheumatologists who were kind of given the reins to diagnose and then treat fibromyalgia, I think are probably the worst physicians for that task. The main reason is because the only thing they have available are drugs. And that's probably typical of most conventional doctors. But rheumatologists, it's rare you'll find a rheumatologist that knows anything natural, about natural protocols, knows anything about functional medicine. Not saying that there's not any out there. They're just very hard to find. Even harder to find one that really understands fibromyalgia other than just treating the symptoms. And we see that in fibromyalgia, it's really a matter of treating the symptoms. And the problem with that, there's just so many symptoms. Talked last time a little bit about fascia. Not going to be able to go through that tonight, but you can see last week's, again, replay. Central sensitization pain syndrome, this is where pain is magnified. It persists. It doesn't turn off. And this is what we see in fibromyalgia. They have a hyperexcited state. Their nervous system is hyperreactive to pain, and it doesn't turn off. And that's exhausting. I mean, it's exhausting to have that pain. My patients, talk about 24/7, this pain that just never goes away. There is no definitive inflammatory marker that we can find in fibromyalgia, but inflammation is certainly there, and it affects soft tissue, whether that's muscle, connective tissue, tendons, ligaments. It can affect joints as well. It can be anywhere. It can affect the nervous system, tingling pain, burning pain, itchy pain. And these are all, this pain is all associated with central sensitization pain syndrome. So again, can't go into the detail about that. We talked last time about the FMA test. It's been around for over a decade, and it is now, I think, covered by insurance, and is pretty reliable. Although I mentioned last time, once you get the diagnosis, then what? So for most people, it takes anywhere from 7 to 12 years to get the diagnosis of fibromyalgia because everything has to be ruled out. And then finally, you get someone and says, "Oh, I think you have fibromyalgia," because they've ruled everything else out. And a lot of times, my patients share with me that they think, at least I'm not crazy. Someone can tell me this is what's wrong with me. But then that's where your journey begins. Because now what do? Now you finally got the diagnosis. But what do doctors tell you? They tell you just have to learn to live with it. And there's many different theories, hypotheses about what causes fibromyalgia, whether that's trauma, whether that's emotional, physical trauma, mental trauma, stress, low thyroid, yeast overgrowth, mold toxicity. I mean, there's all kind of different things out there for saying that's the cause of fibromyalgia. But what we do agree on is that fibromyalgia is associated with allodynia, which is a low pain threshold, and hyperalgesia, which means the pain is magnified. This is what we see in fibromyalgia. Fortunately, even though there is a miscommunication between the nerve impulses of the central nervous system, which is amplificating the pain, there's things that you can do to dramatically reduce your pain that by the way, doesn't involve taking pain medication or potentially dangerous prescription drugs. And I went into detail, so please check that video out. But I went into detail and you can learn more about it. But I talked about how those with fibromyalgia have a elevation of a hormone called substance P. And when substance P is elevated, your pain threshold goes down, so pain is magnified. So what we want to do if substance P is elevated, We want to reduce it so we can raise our pain threshold, and that lowers our pain overall. Talked about last time about mitochondrial defects, and this is a really important. This explains a lot of what we see in fibromyalgia with the inflammation, with the fatigue. If you've not read this blog that I put out called The Cell Danger Response in Fibromyalgia, it's on my website, yourfibrodoctor.com, and you can find that. And it goes into much more detail about this. But what we know in fibromyalgia is that the majority of those with fibromyalgia have a deficiency in mitochondria, and the mitochondria that they have are decoupled. They're not working like they're supposed to. Your mitochondria are your power plants of the cell. If they're not working correctly, your cell is sabotaged. Its ability to communicate with other cells, its ability to release anti-inflammatory chemicals is sabotaged. Its ability to generate energy for your metabolism is sabotaged. So what you see is without the number of mitochondria that a normal person would have, you're already at a kind of a disadvantage. And then if you get under too much stress and the mitochondria go into this thing called cell danger response where the cells think they're being attacked, and it doesn't matter. It can be real or imagined. It does any kind of stress can bring this on. It can be it can be a death of a loved one. It can be years of struggling in a dysfunctional marriage or dysfunctional work environment. It can be from something acute like a surgery that you just had or an illness. But when the bodies think it's being attacked from mold or pollution or just we never turn our brains off, or years of poor sleep and all the stress that goes with that, what we see is that your energy goes down and your pain goes up. And how do we start to fix that? Well, we start to fix the mitochondria by making sure that it has the raw ingredients that it needs. And the raw ingredients are high doses of magnesium, malic acid, CoQ10, other amino acids, B vitamins. And those are what are in the Fibro formula for that very reason, to get the mitochondria to come back on so that they're doing what they're supposed to do, which is to help with inflammation and definitely help with energy. So magnesium deficiencies is common throughout North America, but certainly so in fibromyalgia. If you're not taking magnesium, you definitely need to be taking magnesium. Magnesium's in 300 biochemical reactions, and anytime it becomes deficient, those reactions are sabotaged. They're certainly compromised. Anytime you get under stress, the body needs more magnesium. And I can't think of anything more stressful than having a chronic illness like fibromyalgia, not sleeping well. People don't understand what you're going through. Maybe you're taking some prescription drugs that are causing some stressful problems with side effects. So it's no wonder that your mitochondria are not working like they're supposed to, and they desperately need some help. You see that with fibromyalgia, you have a dysfunction in your hypothalamus, which is a gland in it's an organ in the brain that controls the different systems in the body. Once your body gets under too much stress, and again, that can be from all the things I mentioned earlier, but typically there's the straw that breaks the camel's back, some kind of stressor, and you just can't recover. Maybe start off with poor sleep, maybe just fatigue, maybe just diffuse achy pain, and it just gets worse and worse and worse. And then finally you get the diagnosis. And the reason why the hypothalamus, this organ in the brain, is so important, because it's monitoring everything that's going on. It's always monitoring different hormones, these hormones, which are messengers that tell the thyroid to work better, or it's monitoring our digestive system, it's monitoring our immune system, our sleep-wake cycle, our pain threshold. But when it gets under too much stress, it can become compromised. And now normally these different systems should be talking to one another, but when it gets under too much stress, now they start talking different languages. And because of that, that's why we see there's so many symptoms associated with fibromyalgia. It's not just the pain or the fatigue, but it can be brain fog, it can be insomnia, typically is, irritable bowel, leaky gut. There's so many things that starts to show up because the body just can't regulate itself. And so the hypothalamus, pituitary, adrenals, we'll talk about the adrenals tonight. It causes impaired function of the brain and the endocrine system. Your endocrine system is your hormonal system. It's the messenger system. So everyone is probably familiar with thyroid hormones that control your metabolism, but you have all kind of different hormones. You have neurotransmitters. These are brain chemicals like serotonin. I talked into depth about that last week. Please watch that video. But the higher your serotonin level, the higher your pain threshold. And the higher your serotonin level, the less likely you are to have an elevation of substance P. So we want to get that serotonin level up. And as we do that, you see that allodynia, this low pain threshold, your low pain threshold will go up. So your pain threshold goes up, so pain goes down. That's important because the thing is, you get in this vicious cycle where you don't sleep well because of this disruption in the body's ability to be able to regulate itself. So you never feel rested the next day. And then that sets up more and more inflammation, causes you to have more pain. More pain causes more stress. More stress causes you to have more fatigue, be more likely to have irritable bowel, anxiety, depression, brain fog, and these other things that go with that stress. And then further just depletes your stress coping chemicals, and then you're just in this vicious cycle that continues on and on and on. So sleep is important. That's where the 5-HTP comes in. 5-HTP raises your pain threshold by making serotonin when it's combined with the Fibro formula. But the 5-HTP also increases your natural sleep hormone by 200%. We look at just the traditional approach to treating fibromyalgia. It's based on treating symptoms, not causes. What we want to do is we certainly don't want to learn to live with it. No one should have to learn to live with chronic pain and fatigue and brain fog and being limited what they can do on a daily basis or a weekly basis. Some of my patients had to choose what they were going to do that week. That could have been just getting a shower, just getting, bathing. That's all they could do for that week. They'd been in bed for 18 hours or more a day. This is a very common thing in fibromyalgia, and most doctors will tell them just to learn to live with it. And I don't know how someone can tell another person who's bedridden, has given up their social life, a lot of times their work, career, their friends, their family doesn't understand what's going on. They give up their hobbies. I mean, how can you tell somebody just learn to live with it? I don't know. Pain meds are not the answer. You cannot drug your way out of fibromyalgia. The people who take Neurontin and Lyrica, you need to realize the potential side effects includes diffuse achy pain, ironically nerve pain, poor sleep, brain fog, increased risk of macular degeneration, increased risk of type 2 diabetes, because typically you gain sometimes as much as 10 pounds a month on this Neurontin or Lyrica, Grillis, gabapentin. These medications are not long-term, are not the answer. Pain medications, I'm not anti-pain medication, and I'm not anti-drugs. There's a time and a place. I am anti-drug only. I'm anti too many drugs. I'm certainly anti-wrong drug. You can't drug your way to fibromyalgia. There's just too many symptoms. You want to treat the underlying causes. And if we look at antidepressants, which are so common here in America anyway, 1 in 10 females doctor's visit involves a prescription for an antidepressant. And you need to realize that these medications do not make the brain chemical serotonin. They only help you hang on to what you have. But if you're taking a selective serotonin reuptake inhibitor and there's nothing to reuptake, it's not going to do anything. It's like using a gasoline additive in an empty gasoline tank. If you're running on fumes, you need gas. You don't need a gasoline additive. These medications can be helpful, but we need to realize that 70% of the time, they're no better than a sugar pill. The studies show that 70% of the time, antidepressants are no better than a placebo. And they're associated with all sorts of potential side effects, including, ironically, anxiety, depression, diffuse achy pain. Some of them can interfere with your sleep. Some can deplete CoQ10, which is the spark plug of every cell. You need it to make the energy of the cell kick in. They can cause something can cause weight gain, something can cause problems with mental clarity. So they're not something that you want to be on. And no one has an antidepressant deficiency. Sleep medications increase your risk of death by 500% across the board. That's not to scare you. That's just to share with you. You need to find a more natural way to be able to fall asleep and stay asleep. I went over my protocols last week, and you can see that. We're all born with a stress coping savings account. And in the stress coping savings account, we have certain chemicals that we need to be able to deal with stress on a second by second, moment by moment basis every day. So we have all sorts of different chemicals there to be used. Serotonin, dopamine, those are 2 brain chemicals, 2 hormones in the brain. Serotonin, dopamine, cortisol. We're going to talk about cortisol and DHEA just in a minute, which come from the adrenal glands. Human growth hormone. You need to go into deep restorative sleep for human growth hormone to be released to repair your damaged tissue. That's when the body is healing itself. And if you're never getting into delta deep wave sleep, you're not repairing. Your body is not repairing itself, and you're going to wake up every day unrefreshed, exhausted, and in pain. You've got to get into the deep delta wave sleep. Norepinephrine, vitamins, minerals, antioxidants. These vitamins, minerals, amino acids, and hormones are released anytime we get under stress, real or imagined. Now, we make deposits into our stress coping savings account when we go into deep restorative sleep. That's how the body refills our account. But if you're not getting into deep restorative sleep, on a consistent basis, you become bankrupted, including you're bankrupting one of the key hormones you need, one of the key chemicals, which is serotonin. The higher your serotonin level, the higher your pain threshold. The higher your serotonin level, the less pain you have. The higher your serotonin level, the more the mental astute you are. Mental clarity improves mental clarity, boost your happy hormone. Serotonin is a happy hormone, calms everything down, helps with irritable bowel syndrome because it helps regulate how fast or how slow moves through the intestinal tract. Serotonin comes from 5-HTP, combination of 5-HTP plus the Fibro formula. That's where serotonin comes from. That's why I designed the Fibro formula to have 5-HTP and the Fibro formula in there. If you're not sleeping well and you're waking up every day unrefreshed, you've probably made more withdrawals than you have deposits, and you've bankrupted your stress coping savings account. The key to overcoming fibromyalgia is to treat the underlying causes and to fix remedy the root causes of what's going on. The place to start is the Jumpstart pack because that's lays the foundation. 5-HTP combined with the Fibro formula, you want to use the protocols I shared last week, how to get into deep restorative sleep. 5-hydroxytryptophan plus the key synergistic amino acids, minerals, and other ingredients in the Fibro formula. When those are combined, it makes serotonin. Serotonin, 5-HTP increases your natural sleep hormone melatonin by 200%. So the combination of 5-HTP with the Fibro formula making serotonin, we can see helps reduce pain, helps with sleep, helps reduce those tender points, helps reduce anxiety. It improves overall mood and helps improve irritable bowel syndrome. Stress, we all have stress. So not only have you bankrupted your stress coping savings account, but you've bankrupted your stress coping glands, the adrenal glands. And the adrenal glands they're small, they're very small, but they're really important. They're about the size of peas and they sit on top of our kidneys. But anytime we need some help with stress, the adrenal glands' role is to release cortisol to help us deal with stress. In the beginning, if I've got this gas, don't think I do. So the adrenal glands, what they're supposed to do is release cortisol when we're underneath stress. So you can self-test to see, do you have adrenal deficiency? And you do that one of two ways. One, you can go into a dark bathroom, with the light off, and you cover one eye. And while you're looking in the bathroom mirror, cover one eye, but shine a pin light in the other eye. Now, what you should see is that the uncovered eye, when that light is hitting your pupil, it should constrict, so it should get smaller. Your pupil should get smaller. If it enlarges within like 30 seconds or so, that's a sign of adrenal fatigue. And that has to do with an imbalance of potassium and calcium. But if your pupil gets small, but within 30 seconds opens up, that's a sign of adrenal fatigue. Now, you can also test adrenal function by testing it lying down and taking your blood pressure. So you can take your blood pressure lying down with a blood pressure cuff, and then you want to take it again standing up. When you stand up, make sure you take it within 30 seconds of standing up, and you want to make sure your left arm is perpendicular to you, so it's out in front, and it's at heart level when you take it. And what you want to see is that top number, the systolic number, should go up. It should not stay the same. It should not drop. It should go up. If it does not, that's a sign of adrenal fatigue. So anytime you get under stress, your body is releasing adrenal hormones. If in the beginning, it's releasing adrenaline. So how many of you are familiar with that hormone, adrenaline? That's what gives us drive, ambition, zip. Adrenaline and norepinephrine. So we get under acute stress. So if we're driving down the road and we're swerved to miss something, adrenaline is going to be racing through our body, and it's going to be causing the body to release certain hormones and chemicals to make us more alert about what's coming. This is called the flight or fright reaction. It allows the body to be ready to deal with any type of challenge, any kind of stressful challenge. That's short-lived, so it shouldn't last very long. Your adrenaline goes up and then it wears off, right? Have you ever been to a scary movie? You go to these scary movies and you get all hyped up. It may take an hour or two to wind down. Or maybe you go to a ball game and you get all excited with the crowd and everything. It may take you a little while to wind down. That's because norepinephrine or adrenaline has been released and it's causing the body to be heightened in a heightened sense of awareness. However, once all that wears off, you get into the chronic stress mode. And that's what happens with a chronic illness like fibromyalgia. After years of poor sleep, dealing with physicians who really don't understand what you're going through, taking medications that are not solving your problem and oftentimes creating more problems. Your body is done. It just, when you ask for help, it tells you, sorry, I can't do it anymore. And once you lose the ability for your adrenal glands to be releasing cortisol, which is an anti-inflammatory, a potent anti-inflammatory, now not only do you start to have more inflammation and pain, but now you become vulnerable to fibro flares and your resistancy to stress has become compromised. Cortisol is incredibly helpful in reducing inflammation. How many of you ever had a steroid injection, maybe for a sinus infection or some type? Maybe you had a low back, symptom in your low back, or maybe you had injection in your knee, maybe you had knee pain, they put steroid in there. Or maybe you took a dose pack. It's a 5-day dose pack where I forget the number, 5, 4, 3, 2, 1, I think, where you take that. What that's designed to do is to reduce inflammation because your body is overproducing these inflammatory chemicals. If it's a sinus infection, then you've got all this congestion. If it's a low back, you've got all this swelling in your low back, or if it's in your knee. The adrenal cortex that's in the fibro jumpstart is not like taking steroids. It's not like a prescription. What it's designed to do is to reset your adrenal glands. Yes, it does have some cortisol in there, but not like taking a steroid. You don't gain weight on this. You don't suppress your immune system on this. What you'll find is once you start taking the adrenal cortex, one with breakfast, one with lunch, you'll start to see your ability to rebound from stress is improved. Because what happens is as you deplete your stress coping chemicals from poor sleep, start to get run down, your inflammation goes up. So now you have more pain, but you also see that you don't handle stress very well. So loud noises, bright lights, physical activity, mental activity, things that you used to probably take for granted, it doesn't take much to really set you off. So you really have to, be strategic about what am I going to do today, or what am I going to do this week, or what am I going to do this month? What am I going to be, what am I going to be able to do without crashing? Once you start taking the adrenal cortex and the jumpstart package, you'll see within a couple of weeks, you're going to have more energy mentally and physically. You're going to have less pain because of the anti-inflammatory effect. But the big thing you're going to see is you're going to have more stamina. You can do more. Until you start to fix your adrenals, start to get good night's sleep, you're going to see it doesn't take much to set you off. You could have a good day out of the blue. Maybe you slip, maybe you got a good night's sleep. Maybe you're taking the 5-HTP and the Fibro formula and your serotonin levels going up, your melatonin levels doing great, and you're actually sleeping for the first time in years, but you overdo it. You go to the grocery store, or you cook dinner, or you try to clean the house, or clean out of college, or stay an extra couple of hours at work, or go to a ball game to see your grandkids at night. And then you're in bed for 2 or 3 days. You got to fix the adrenals. If you don't, you're vulnerable to flares. So again, self-test to see, but everybody with fibromyalgia is going to have a problem with their adrenal glands. That's just the way it is. You're going to be low in serotonin. You're going to be deficient in key nutrients. That's why they're in the Fibro formula. The malic acid, the amino acids, and those other things are in there for that reason. So the Fibro formula is based on the optimal daily allowance. The recommended dietary allowance, which came about in the 1930s or 40s, is based on the recommended disease allowance. If you go by these criteria, it's just enough to keep you from getting beriberi or scurvy. It's not going to make any difference in your fibromyalgia pain, in your energy, in your restless leg syndrome. None of that is going to be helped. You want to make sure you saturate your cells, and you do that with something like you do that with the Fibro formula. And then once you combine the Fibro formula with the 5-HTP, that's where serotonin comes from. I thought I had another visual here I wanted to. So I had people say, well, Dr. Murphree, I'm taking a multivitamin. But if you're taking this, Essentium Silver or one a day, or this is worthless, by the way, it's got so many additives and preservatives and fillers in here, but you would have to take something like 100 or I don't know how many bottles you'd have to take just to equal 1 dose of the Fibro formula. So if we take B6, which is crucial for fibromyalgia because you need B6 combined with the neurotransmitters to make serotonin. So you need B6, B12, B2, B3, vitamin C, magnesium, and certain amino acids to make serotonin. And you need this B6, and without it, you can't make it. So I've got 50 milligrams in mine because I want to saturate the cells to make sure that you are absorbing at least some of it. And whatever you don't need is going to be voided out when you urinate because it's water soluble. And I'm looking for B6, which has 5 milligrams. Mine has 50. So you're just not going to see a difference when you're taking something like that. It's just not going to happen. Okay. So let me come off here. And so if you go here to my website, Your Fibro Doctor, if you go up to the top, you'll see Patient Center, and you can hit health condition articles. And I shared this last time. Whoops. I shared this last time, but one of the things you want to do is um, go to the brain function questionnaire, and it will share. You'll be able to take a little survey, and it will tell you what you're low in. Everyone with fibromyalgia is going to be low in 5-HTP. You can read the article about sleep where I go into much more detail about using 5-HTP and melatonin. So that's all there. There's testimonials. There's hundreds of testimonials on here. There's Dia's testimonial, and they have audios that go with them, me interviewing. So if that's of interest to you, you certainly can do that. But I have dozens and dozens of those on there. You can also go to the store, and I'm going to bring this up so you can see the videos. So here's the Jumpstart package right here, and there's videos in here. There's testimonials, yeah, but there's a video that goes to the Jumpstart right there, and so these videos are free, and you can just watch these videos. They'll go into the detail, so all about digestive enzymes, how to use them. And then this is about, it'll tell you how to use it. And then the last one is this one, adrenal cortex. And there's about a 10-minute video about the protocols here, 2 minutes. So really, but this is the Jumpstart package. This is what I created years ago. And this took the place of intravenous IV therapy. It took the place of people going to the health food store and coming back with 15, 20 different bottles of stuff that really was not going to do anything. When I formulated this years ago, I've changed it over the years, but it has really been a godsend for me to have this and for patients to be able to respond to it. So I'm really delighted that it has done. Okay, let me take your question. So one person says, I can't gain weight, and I would encourage you to continue to eat healthy. There's, eating a whole foods diet, but there are protein shakes, and that's what I would increase protein shake intake, but healthy protein shakes, which would be whey protein or plant-based protein like pea. But yeah, one of the things that can cause that is hyperthyroidism. So make sure you get your thyroid checked, get your thyroid hormones checked to make sure they're not elevated. But then with fibro, a lot of people can't lose weight. And that has to do with just years and years of just getting so run down and being sedentary. It doesn't matter what you eat or don't eat, you just can't lose weight. If you are looking to lose weight, then what I would encourage you to do is to look at the Slenderize weight loss program. So it's 2 drops. There's an appetite suppressant and a fat burning homeopathic drop. They're all natural. They're non-stimulating. So if you have high blood pressure and other things, you can take them without any issues. So here's the store, yourfibrostore.com. But if you want to read more about the weight loss program that I'm recommending, and I'm going to do a program tomorrow night, 6 p.m. here on Zoom, same place here. But you can learn more about this diet. Typically, my patients lose half a pound a day on this, and there's no prepackaged foods, there's no prepackaged shakes, there's no weigh-ins, there's no drugs, there's no shots. It just, by taking these drops, you suppress ghrelin, which is your hunger hormone. It just totally causes it to cave in, so you're just not hungry. And then it also increases leptin, which is a hormone that tells your body when you're full. So you suppress the appetite hormone, so you're not hungry, and you increase the leptin, which tells you that you're full. So patients typically lose half a pound a day. Men typically lose a pound a day. Just eating a healthy diet that comes with this. There's no counting calories. You don't have to count calories, but typically within a 30-day period, you're going to lose about 15 pounds. And the weight comes off when you do the maintenance, which is just eating healthy. Doesn't mean you can't ever cheat. You can, but this is what my patients are using, and they're doing very well losing weight back to. The question is, that 20 to 50 years from just the onset, or we have it for life? It's the onset, but you're always going to have fibromyalgia. That doesn't mean that you can't overcome it, because if you look at those testimonials, and I've got dozens and dozens and dozens of people who have overcome their fibromyalgia, but it's like type 2, it's like diabetes. It's there. If you don't do the things you need to do, it's going to rear its ugly head again. And that's probably the main reason why I continue to doing these live presentations, even for my patients because periodically I'll get an email or my assistant Juno will get an email at the clinic saying, "Hey, I've fallen off the wagon. I'm back in a flare. Haven't been taking my supplements, haven't been off the Jumpstart pack, those 4 products for the last 6 months, and now I'm back where I was. What do I need to do?" These presentations are much targeted to people that I've never met, but they're also targeted to some of my past patients. And I want you to continue to get better, right? I want you to not go into flare. Yeah. So you can go into remission and you can get over it, but you got to be careful because what brought it on was stress and not taking care of yourself. So someone says, mine has never gone away. It's gotten worse as I've gotten older. And that's typical. Unfortunately, in conventional medical practice, treating fibromyalgia conventionally, it shows that in a 15-year period, you're no better off on the common drugs. In fact, you're worse. Over that period, it's estimated you're going to spend almost $2 million um, on your health care. 600,000 of that out of pocket over a lifetime of fibromyalgia. So you want to do everything you can to get over it. You don't want to just treat it. You don't want to treat the symptoms. In conventional medicine and even, unfortunately, functional medicine, the way that I practice, trying to look and find the underlying causes, most people don't understand fibromyalgia. Certainly not conventional medicine where it's about treating the symptom. You're if every time it rains, you've got a puddle of water on your kitchen floor and you just mop it up every time. I mean, you can do that, but eventually it's gonna destroy your floor, right? Gonna get mold everywhere. You're gonna take up your tile. I mean, it's just gonna be a mess, right? It's gonna be a long-term, expensive mess. So rather than treating the symptom, the water on the floor, which is just a warning sign, why not treat the cause, which is the hole in the roof? Fix that, no more water on the kitchen floor. Same thing with fibro. Once you start taking the Jumpstart supplements and you follow along with the protocols, now you can start to reverse your symptoms because you're treating the underlying causes, including poor sleep, inflammation, the brain fog that comes with poor sleep, nutritional deficiencies, low serotonin. Now you can create your own serotonin without using a gasoline additive like an antidepressant with the combination of 5-HTP and the Fibro formula. You can fix your adrenal glands with the adrenal cortex, and you can start to correct any kind of GI problem, whether that's malabsorption, bloating, reflux, or IBS by using the digestive enzyme. So the person who shared that have had it and it's gotten worse as they've gotten older also shares that they've been on meds for 30 years and a lot of meds on the side. Yeah. So, I mean, it can start. We see a lot of times that fibromyalgia starts actually when you're young. We see that unfortunately fibromyalgia can come on due to stress. I mentioned that earlier, trauma. And we see that a lot of kids get under a lot of stress at an early age, whether that's a toxic household, maybe you've moved a lot, military family, were really sick as a child, some type of very stressful thing is happening in your household, and you lose your ability to rebound from stress. You lose that plasticity. Is what we call it in the medical community. You lose the plasticity. And so when you get under stress later in life, it doesn't take a whole lot. And it could be, going off to college, getting married, having your first child, toxic work environment finally just catches up with you, whatever it is. But there's a straw that comes along and breaks the camel's back, and you're never the same. So it's a matter of building up your stress coping chemicals, and that's what the Jumpstart protocols are all about. By doing that, the body can start to repair itself, dramatically reduce your pain by raising your pain threshold. There's no side effects with the weight loss drops other than getting healthy. Thanks for that question. The diet is a whole foods diet where any vegetable you want, any animal protein you want, any vegetarian protein you want, as long as it's on the approved list. Butter's fine. Obviously, no sugar and no white bread, no white potatoes, no simple carbs. But yes, the diet is easy to follow. There's no calories. You don't have to count any calories. The game changer from losing weight if you have fibromyalgia is unbelievable. 10 years ago, when I started using drops similar to these, I've changed because I like the diet better with these. It was a game changer for me because I knew that if I could help my patients lose weight, if they needed to, not all my fibromyalgia patients were overweight, but a number of them were. I knew if I could help them lose the weight, that they would see a dramatic reduction in their pain because you store inflammatory chemicals in any extra fat cells you have. So if you're carrying around 10 extra pounds, 40 extra pounds, that's where you're storing inflammatory chemicals. And those inflammatory chemicals are being released all day long. In particular, the ones that are really dangerous fat cell or belly fat. So this is the yellow fat or visceral fat, and that fat is not just sitting there dormant, it's releasing inflammatory chemicals all day long. That's why it increases your risk of heart attack, stroke, and certain cancers. Once you start to lose that weight, you will see a dramatic reduction in your pain and a dramatic increase in your energy, your mental clarity, and your ability to fall asleep and stay asleep. So the diet is a game changer. The drops work, they work. And the diet is easy to follow. It's a diet that you should be following because the only way you can overcome fibromyalgia is to get healthy. You can't overcome it. You can't drug your way out of fibromyalgia. You have to get healthy. And the sooner you realize that and start that and be proactive about that, the sooner it happens. Diet, you can't be healthy without having a healthy diet. You can't. So start with the Jumpstart protocols, change your diet at the same time. Changing your diet will take time. Starting in the Jumpstart protocols, those 4 products, and using the protocols, you'll see results within 2 weeks. The diet's going to take longer. But if you have to lose weight, I know it's incredibly hard to do so because your metabolism is so low with fibromyalgia when you got so run down. That's why the drops are such a game changer. They allow you to be able to start the drops. You're going to find within a day or two, you're not hungry. Within 4 or 5 days, your stomach has shrunk. So when you go to eat, you just can't eat it. Sugar cravings are gone within a few days. Salt cravings are these preservatives and additives, all these foods that we want to snack on because we're addicted to them. Within a week or so, those are gone because your taste buds literally change on the diet. So if you need to lose weight, if you're carrying around extra weight, best thing you can do is lose that weight and get rid of those inflammatory chemicals. And also that's where you store toxins as well. So as you lose that weight, you're also getting rid of toxins. Thanks for joining me. I look forward to your questions next week.
Thanks for listening to Super Healthy Human with Dr. Rodger Murphree. Remember, your body is designed to heal. It just needs the right tools. Stay curious. Stay consistent. Stay super healthy. If this episode helped you, leave a review or share it with someone who's ready to take charge of their health. The information provided in this podcast is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Always consult your physician before making changes to your health regimen. This content does not substitute medical care.